Welcome to the Science and Cocktails podcast.
Get on your spaceship.
Interesting theory.
And now the machine is working.
Increase the frequency of lucid dreams in our laboratories.
Over time, the variation within a group becomes variation between groups.
It has to do with particles or objects and how they move.
Am I true? Am I awake?
We think that there is a kind of God against it.
What are the processes behind?
It's a piece of stuff.
We are moving in space-time. All of us go like 1 second per second, flowing up in the fourth dimension.
I'm Sophie Hjort, and I will be your host today on the first episode of the Science and Cocktails podcast, which will be about loneliness in the corona crisis.
We were a whole group of researchers feeling that this was a major public health crisis.
This is Naja Hulvej, who is a professor and the head of the section of Epidemiology at the Department of Public Health at Copenhagen University. Most of the interventions implemented by the governments and political leaders all over the world have had the purpose to decrease death rates and to protect the physical health of the populations. However, the extent of the corona crisis relates not only to our physical health, but also to our mental health.
It's obviously a crisis with the coronavirus, but there was also maybe larger implications.
In the beginning of the lockdown of Denmark in March, Naja Hulvej and her research group started a both quantitative and qualitative study of how the corona crisis is affecting the mental health of the Danish population. Following the corona guidelines, I met her for an interview on a sunny day in her lovely garden in Copenhagen.
We started collecting data on loneliness, social isolation, worries, lots of mental health measures already from March 23rd we started the first data collection, and then we asked a random sample of Danes every third day for the first period during the lockdown, and then every once a week from the start of the reopening about loneliness and other mental health measures.
Okay, as I've read, you chose 5 different population groups. Why did you choose these 5 groups?
For the repeated measures, we only had 3 groups. So one was the general population, obviously because we wanted to follow what happens in the adult population. I should mention it's not children. Then we started all of this in the very beginning of the lockdown, and one thing that we realized was that families with children were very affected by the close down of schools and daycare. So that's one of the reasons why we chose families with children as one of our focus groups. We also knew that the elderly and people with chronic diseases might be a vulnerable group especially for the virus. So that's why we chose looking also at older people. Then for some of the analysis, we have also looked specifically into young people and to people with mental illnesses because we thought they were interesting groups as well that came around during the project.
We will hear much more about why the group of young people got their attention. Because they wanted to start the data collection as early as possible in the beginning of the lockdown, they had to act very fast.
I think we set up the whole thing in 1 week, and normally we use 6 to 12 months to set up a study like that. So we used the infrastructure of an established survey company to do the data collection for the quantitative analysis for us. So we did these repeated surveys with these different groups every third day during the lockdown, and then once a week during the when it was during the reopening. At the same time, we had some researchers doing more in-depth qualitative interviews with people. So we had people signing up for being contacted by phone for a more in-depth interview about their situation, how they felt about the lockdown, especially during the lockdown period.
The research group was cooperating with the Danish newspaper Politiken. And one of the ambitions of the project was to
feedback results into the public debate right away. So we've been running analysis from the first week of data collection, and doing it, working in that way is not what we normally do in research. We have, long periods where we have peer-reviewed articles and things like that. For this project, we decided we do relatively crude analysis, but we feedback some of these, just how people respond to, simple questions on loneliness or worries or precautions or things like that.
The main focus was to follow people's experiences of social isolation, their worries, and their general life quality, and to look at how they were changing through the lockdown.
Not so surprising, the worries seem to be going down with the gradual reopening. The same seems to be the case across all groups for the social isolation, so that seems to be going down from mid-April when there was a gradual reopening. And life quality is actually relatively stable during the whole period.
The group had a special interest in loneliness because one of the interventions implemented by the government was social isolation.
So people were asked to stay at home, work from home, and we were interested in seeing whether more people felt, obviously more people would be alone by themselves, but did people also feel more lonely during this period? And we did find some quite interesting results, I would say, for loneliness. We found that the loneliness rate was quite high across all age groups. It was particularly high among the youngest people, so those below 30. We found that actually 1 in 5 people reported loneliness. And that's almost comparing to numbers using the same measures, but before the crisis, it was about 1 in 10. So a doubling of the number of lonely people reporting high on a loneliness score during the crisis compared to 1 or 2 years before in the same age group. So I think that was a major finding from the study. We did see across, to be fair, we did see across all age groups that there was a major increase in people reporting loneliness. But because the younger people generally report more loneliness because they are probably in a life phase where there's lots of things going on in terms of social relations, social community, they generally report higher also before the crisis. But so there's about a doubling for all age groups, but particularly the young ones, there's 1 in 5 feeling loneliness during this period. That's quite high, I would say.
This group of young people has been extremely affected by the lockdown, which has been overseen in the public debate.
For young people, the social communities are extremely important. So that would be, schools, groups of friends, going to parties, all of that. It's a larger part of younger people's daily life and what makes it or what is important for quality of life among young people than among other groups. And that is quite well established that, this group, which we defined it as people between 18 and 30. So it's a group of people who are moving away from their family homes. Lots of these people, a higher proportion, will also be living alone, because they're living in their, student accommodation or whatever. So they don't have the family around them. Normally they would, use other social relations, such as going out with friends or going to your educational discussion forum or whatever, to substitute some of the social contacts you get in a family. And that was just closed down during the lockdown. So I would say it's not so surprising, but I think there was not so much attention to the young people during the crisis, especially during the lockdown. There was lots of attention on the older people, and I think we did really see an increase in loneliness among the older people as well. The increase was actually much higher in at least in absolute numbers among the youngest people.
Social media has played an even greater part in our lives during the corona crisis, in both our work and in all our social interaction. But even though the young people have spent a lot of time on social media, it has not cured their loneliness.
It's important to say that loneliness is not the same as being alone. You can be together with a lot of people and still feel lonely. And I think that's one of the things that's been discussed on social media, is that you have lots of more superficial contacts on social media that might not be the kind of close contacts that you would need to not feel lonely. But that is just I don't have really data to support that, but that would be one of my interpretations of what's going on. So yes, there's lots of opportunity on social media, but I think we have all, during this crisis, realized that a lot of the things that goes on between people, face to face, cannot be substituted with social media or Zoom meetings or whatever. So I think that goes for all of us, that there is a need for more than just what happens on an electronic platform to reduce loneliness.
How affected the young people have been by the lockdown is the most important finding of the study, because it has been overseen in the public debate.
I think no one really had the attention directed in that direction. So I think that's at least an important finding that I think we've fed back to the public debate on how the crisis is being handled.
Loneliness, especially if it's for a longer period, is a serious condition, and it is highly related to stress and can be health-threatening.
There is an increasing literature on how loneliness relates to a number of other mental health outcomes, and especially it seems like people who report high on loneliness also tend to at the same time report high on stress scales. It seems like, especially, I think what's important to mention here also, when we talk so much about the major increase in loneliness, is that it's probably not a short-term period of loneliness that will have long-term consequences in terms of mental health or physical health. But that said, I think people who are experiencing prolonged period of loneliness tend to have a higher risk of depression, more severe stress reactions, and also, and that's still being discussed, but also maybe a number of more physical health outcomes in terms of increased risk of cardiovascular disease, diabetes, and so on.
Okay, so when you say a relatively short period, is this what we experienced through the corona pandemic? Is that a relatively short period, so it won't have that much effect on our mental and physical health? Or?
So that would be my hope. So my hope is that we do see a reduction again in people who feel lonely. If it goes on for, let's say, 1 or 2 months during a major public health crisis, I would not be that concerned in terms of the long-term consequences. It's not fun when it's going on and it has implications for people's well-being during daily life, but my expectation would be that we are getting back to a normalized situation. We will also be getting back to lower levels of loneliness, similar to what we had before the crisis. And I wouldn't be that concerned about, the short-term loneliness and how that affected health in the long term.
The mental health of the Danish population has been affected dramatically during the lockdown of the country, but populations of other countries, where the lockdown has been even more radical, can be affected even more. On WHO's homepage, it says that levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior are expected to rise. Only time will tell how extensive the consequences will be. And on that note, this story will end. Thank you for listening to the Science and Cocktails podcast. Find future episodes on scienceandcocktails.org. The Science and Cocktails podcast is funded by the Novo Nordisk Foundation and produced by me, Sofie Hjort, in collaboration with Hjalte Bisted Møller, also known as Tromleorkestret, who has originally composed all the music and sound effects, especially for this podcast.